Diabetes in old age is an increasingly common disease, and its complications, especially cardiovascular complications, are important causes of death in these people. Type 2 diabetes mellitus increases with age, aged over 65 accounting for 18 to 20%. Elderly people are often subject to many coordinated diseases. The body organs have had a certain decline. Diagnosis and treatment of diabetes in the elderly is more difficult than young people, who require both physicians, patients and families to have a clear understanding of the disease. Therefore, it is necessary to have appropriate monitoring, care and treatment regimes for patients to manage blood glucose, prevent complications and achieve quality of life. Harmful health effects of type 2 diabetes in old age. The number of people with diabetes increases with age, but in a recent survey, 1 in 5 to 6 people over the age of 60 were diagnosed with diabetes, which is an amazing number about the number of people with diabetes. The reasons for increasing the incidence of diabetes in the elderly are changes in glucose metabolism, as insulin secretion and insulin resistance increases with age, as older people often have to take a variety of drugs, which affect blood sugar, due to a sedentary lifestyle and because they often have obesity or overweight. The problem of blood sugar control of diabetes in older patients. Good control of blood glucose is still the core issue in the treatment of diabetes. Strict control of blood glucose is a top goal, but is at risk of hypoglycemia. Treatment goals for elderly diabetic patients in general are: fasting blood glucose levels near normal levels, less than 7 mmol/L, HbA1c less than 7% without hypoglycemia. Because, in the elderly, the liver's ability to resolve drugs or the kidney's ability to eliminate drugs, the drugs that lower blood sugar are more effective than expected. Hypoglycemia is usually more serious in the elderly. If autonomic nerve function and cognitive function decline with age, it may also be difficult to recognize symptoms of hypoglycemia. Hypoglycemia increases other risks such as consciousness disorder, coma, stroke or fracture. Severe hypoglycemia can also damage the brain, leading to cognitive impairment, in which case the ability to become bedridden. To prevent hypoglycemia, patients need to know what medication they are taking. Insulin drugs, sulfonylureas (SU), and drugs that stimulate the release of fast-acting insulin, glycine, often cause hypoglycemia. If you regularly use these drugs, when you eat less, want more or exercise more vigorously than usual, your blood sugar will be easily lowered. Treatment measures to care patients of diabetes in old age. Treatment and basic control indicators in the elderly are the same as for young people. However, in the course of curing and living with the disease, attention should be paid to changes in psychology and body due to aging in the elderly. Next, are the summaries of the elderly's treatment and care notes. Food therapy to diabetic patients. Low-calorie diet, low in fat. The recommended diet for the elderly with diabetes is a calorie-reducing diet. Fat less than 30% calories, carbohydrates greater than 50% calories. Enhance fiber, vitamins. Drink enough water. Divide meals into small meals throughout the day. Protein is especially important in the diet. Protein-rich foods like fish, meat, soy and soy products. If you can't eat them because your teeth are weak, you can choose eggs. Eggs are also a good source of nutrition. In the past, people thought that eggs should be limited because eggs were high in cholesterol, but now there are many drugs that help lower cholesterol, so the high cholesterol caused by eating eggs is no longer a cause for concern. So, can eat 1 egg a day. Exercise therapy of people with diabetes in old age. Appropriate exercise regimen. Walking, cycling, Tai Chi exercise. If a person stays on exercise for a few months, they will increase muscle strength and increase their basal metabolism, as well as improve the effectiveness of insulin, which in turn will have an impact on the glycemic index. High levels help improve blood sugar control. In the elderly, there are many people who have problems with cardiovascular function, or knee pain. When the patient begins to exercise unreasonably, inadvertently leads to other diseases, such as angina, heart failure, arthritis, etc. Drug treatment. When the body functions decline with age, the elderly need more time to metabolize and excrete drugs that will remain in the blood for a long time. If you continue to supply a dose of medication to the body while the previous drug remains in the bloodstream, hypoglycemia may occur. To avoid such hypoglycemia, when the elderly start drug treatment, they should start with less than the prescribed amount, then will adjust the increase or decrease depending on the reaction in the body. Need to treat well-coordinated diseases. Complications that need to be considered. Diabetic foot. Foot care is important for diabetes in the elderly, especially the elderly because it is often difficult for them to do it on their own. People with long-term diabetes often lose feeling in their feet, so if you do not take care of them will appear sores in this position. Caregivers should regularly check the feet, toes to detect cuts, sores or wounds for prompt treatment. This should be done with daily foot hygiene. Infections in the feet are a very dangerous complication not only in young people but also of diabetes in the elderly that can quickly spread to the bone, leading to osteomyelitis. Hypoglycemia. Early detection and timely management of hypoglycemia in patients is required. Guide patients and family members the signs of hypoglycemia and emergency management of hypoglycemia. Coma due to hyperglycemia. Early detection of consciousness disorders in patients is required for timely treatment. Retinopathy. Complications can lead to blindness. Routine eye examination for patients. Type 2 diabetes in the elderly is a condition that requires strict treatment and management because this is a high-risk patients. In order to improve the quality of life of patients. You want to learn more about diabetes and information about this disease. Please visit our website, forourhealthy.com.